Thank you all for joining this second session of the Poverty and Social Justice in a Post-COVID World conference. This is the 7th Peter Townsend Memorial Conference. And this next session is going to concentrate on poverty and COVID in Europe. Before I start, I would like to just welcome everybody and please remind everybody that if you want to ask questions, please use the Q&A function, which should be on the bottom of your screen, about third or fourth one in from the right. The chat is disabled for this session, and please, obviously, we have to observe proper decorum, and please keep any questions you have to be polite. Before I introduce all the speakers, I'll pass you over to my co-chair. I'm Professor David Gordon. I'm chairing this session. I'll pass you over to my co-chair, Joe Jaskelski, to introduce the Bristol Poverty Institute.
Yes, hi everyone. I'll just share my screen. So thank you, David. Thank you for that introduction, and welcome everyone who has joined us for this session, which is of course part of our two-day conference on poverty and social justice in a post-COVID world. My name is Joe Jaskelski, and I work as the Development Associate for the Bristol Poverty Institute to help forward the initiatives of the Institute and co-create our events and activities such as this one. So to give you a bit of background about the Bristol Poverty Institute, or the BPI for short. The BPI was launched in 2017, and we are an interdisciplinary research institute whose role is to grow, develop and promote the poverty and poverty relevant research community at the University of Bristol and beyond, engaging across sectors to work together to end poverty in all its forms everywhere. This is driven by our mission to explore the interface of different social, political and environmental dimensions of poverty, with the ultimate aim of translating our research on the causes, effects and measurement of poverty into evidence-informed policy and practice, which drives forward social justice. And one last housekeeping point before I give back to David. The session is being recorded. So just to make you aware of that, by attending, you are consenting to being part of this recording. So thank you very much. And David, I'll hand back to you.
Thank you very much, Joe. This session is the second session, as I said, that we had started at 8 o'clock this morning, UK time, with 4 excellent speeches about poverty and COVID-19 in Asia and Oceania. This session will run until 12:30 and will be followed at 1:30 UK time by a session on poverty and COVID-19 in Africa, and then at 4 o'clock UK time by a session on poverty and COVID-19 in the Americas, both North and South America. Please, can you if you're joining, not put your name rather than joining as a guest, so we've got a record of who attended. The recordings will be made available on our YouTube channel after they've been processed. As I said, you'll be able to ask questions in using the Q&A function, and the chat function will not be available. Please, of course, be respectful. We've got 4 excellent speakers. I'm very keen to hear what they've got to say in this session. So I'll start by introducing our first speaker, who is Dr. Alba Lanau, who works in Barcelona. She's worked at the University of Pompeu Fabra. She has done extensive research on poverty and social policy, and particularly not just in Spain and the UK, but across all the countries of the European Union. She is going to talk entitled "First the Children, Then the Employed: Deprivation and Intra-Household Inequality in Europe." And all speakers have got 20 minutes, and I'll tell you when you're close to your time. Okay. Thank you very much. I'm looking forward to hearing your talk, Alba.
Thank you, Dave. Thank you, everyone. I'm sharing as we go. Thanks particularly for inviting me to open this truly impressive panel. I am very honored because it's always very nice to be sitting with people you read. So yeah, thank you very much. Today, as Dave said, I'm going to be presenting a piece of work that's from a project that's finished that I had on inter-household inequalities in Europe. And this is kind of like the flagship paper, if you wish, with the kind of like the main results. And so what I'm going to be giving you is just a bit of a brief highlight of what I found. And it's relatively easy to do because the results you will see are very consistent, and you can expect the answer from the title, which is something I quite enjoy doing. But before I go into the paper, so a bit of just background, what are we talking about? So we know that households do not share resources equally among the members, but we do measure poverty at the household level, and there's many reasons to do that. However, I think it's interesting to kind of like explore these variations. What do we know from previous research? We know essentially that within couples, men tend to have more resources than women. There is much sparser research on the differences between adults and children. There's a wealth of qualitative research that talks about how essentially parents prioritize children, all the sacrifices they go through, but there isn't much in terms of quants. So I wanted to kind of like cover that gap with my project and also look a bit more into the factors that shape inter-household distribution of resources, right? So if there's any differences, how can we explain them, or which factors predict them? Why care? Why do we care about inter-household inequalities? As I said, poverty is measured at the household level, which everybody in this room knows. So if there's inter-household inequalities, we may be misestimating poverty, particularly maybe we're overestimating child poverty. It's just such a prioritization. We can also be underestimating inequality, and particularly gender inequality for sure, but also maybe age inequality. And finally, I think that, or I would argue that understanding inter-household processes helps us inform a bit policy design. And linked to this is the conflicting, what I call the conflicting narratives on child poverty. Is essentially when from a policy perspective, there's two narratives that you can find in most European countries, I find, which is on the one hand, there's this idea of children are the most important and parents do everything for their children. But then there's like a darker side of the story, which tends to apply to poorer households, which is like, well, if you give money to families, they may not spend it in the ways that are more profitable for children, maybe because they don't know, maybe because they just make poor decision making, or like they prefer to spend it on other priorities. So that was also one of the things that was interesting at looking at, whether there's differences across social groups and what this tells us about how we design policy options. So just very briefly on the methods, I used the 2014 Silk deprivation module. There is currently a 2021 model available, but I haven't looked into it, mostly because the results, well, I have looked briefly into it and the results are very much the same. And so I don't think it really grants another article. So in a way, the COVID-19 was false advertising with regards to my paper, but yes, anyway. Story doesn't change, but we have 2014 data for 22 European countries. We don't have data on the registered countries, the UK, Ireland, and Malta, because they did not collect individual information. And I have around 38,000 households with children. My work draws very directly from the work of Dilmain and Jonathan Branshaw. I think Jonathan is here, so Thank you very much. And where they developed this matrix to understand inter-household inequalities in the UK, and I essentially have applied it to all European countries and then extended a little, as you will see. Some limitations of the SILT data, something that I think are interesting to be aware of. I only have cross-sectional information because the adult models are not part of the longitudinal data. I only have heterosexual couples in, there's a suspiciously low number of same-sex couples recorded. And children are assigned to a single household. This is no longer the case with the 2021 data, but for 2014, children with shared custody were just allocated to one household. Then about how the children data is collected, it refers to children aged 2 to 15, so we don't have information on all the under 18s. And also, and this is very important, we don't have information on individual children. So I can't compare siblings or step siblings. We can only analyze households as units, and we can compare adults in the household with children in the household and also adults among themselves, which is what I would do. We have adult respondents for children items, which, as Maggie has said, there can be some differences, but it's not something we can explore with this data, unfortunately. And just a very brief kind of show of the kind of items, which I'm sure you're all familiar with. So it's the deprivation items, and there is many more items for children than there are for adults. So what I've done is I've done my analysis twice, once using all the items, so comparing two different indexes, and once where I match the indexes. So I have only 6 items for adults and the same items for children. And now I'm going to just go straight into the results, because that's the fun part. Okay, so message number 1 is households prioritize children's needs, and this is consistent across Europe. So we have one of those awfully long tables where we have all European countries, the 22 countries I have data for, and for each country you can see which proportion of households are congruous deprived, meaning both children and adults are deprived in the first column. The second, where children are protected, meaning adults are deprived but children are not. The opposite for the third column, so the exposed group is where children are deprived but adults are not. And finally, the non-deprived group. So as you can see, the column that really interests us is the exposed group. So are there households where children do without while adults don't? And we find that this is a very small proportion of the population or of households in all countries. There is a certain correlation with poverty. So countries where poverty rates are higher tend to have more deprived children. This is particularly the case for Romania and Bulgaria, but still it remains a smaller group. Also, it's not fully consistent. And then there's countries such as Greece, for example, where we have relatively high deprivation rates, but also very low child deprivation rates. So first message, as I said, households prioritize children needs. This seems to be consistent. And this is what we find regardless of the measure we use. So we have this 4-item index. Sorry, I said 6 earlier. 4-item index that they can match, or a full index, and you have different thresholds. The story really doesn't change. I turn now to, okay, what are the predictors? What explains this kind of are there some groups that are more likely to prioritize children than others? And to do that, I've run a multinomial regression where I only have the households where someone is deprived. So I drop out the non-deprived households, and I compared my reference categories to protected. So those where only adults are deprived, which is the bigger group. And then I go, okay, which factors may explain the probability or enhance the probability of being consistently deprived? That's the top of the figure, or exposed, so children are actually deprived, bottom. And what do we find? We find essentially in the first half of the figure, all these elements that are associated with enhanced risk of poverty are also enhanced at an enhanced risk of consistent deprivation. So both adults or children are deprived. This makes sense. So we can say things such as income increases, there's reduced probability of consistent deprivation, but also households who have a strong housing burden, a limiting illness, as well as households with a large number of children are more likely to be consistently deprived. And this would just be an effect of poverty. Then for the exposed group, so are the households where children are more likely to go without compared to adults. And we find this is a bit more common in single parent households as well as very large households, which again, there are groups that have enhanced risk of poverty. However, we do not find really any sort of kind of like income element in terms of like, if you look at the income data, there isn't a gradient by which lower income households are more likely to, more or less likely to prioritize children. So overall, there's no differences by social origin. It doesn't seem to explain really the prioritization of children. This is a small aside that I'm doing. I had another paper where I looked at compared intact and reconstituted households. Reconstituted households are those couple households where at least one of the adults is not the parent of one of the children, but there's a couple, right? And the story here goes with US data, and particularly for adults, there is this notion that households are more likely to prioritize biological children, where both, so fully biological children. And this is not something we find for Europe with this data. So we find more like that both intact and reconstituted households, if we look again at this third column, have very similar patterns in terms of like they both prioritize children. Doesn't seem to be an effect of household composition on the probability to prioritize children. And this is with the pool data for all the countries, because of course this is a very small subpopulation. I left you the link there if you're interested. So we've looked at children versus adults, and that's like a fairly clear-cut picture. The next question is, okay, so if adults go without, are all adults equally likely to go without, essentially? Who sacrifices? And this table has a mixture of so it has the descriptors, and then at the very last column, it's the results of a logistic regression model. So if there's a plus, it means there's a significant enhanced positive probability of adult deprivation, and if there's a minus, it means it's reduced. So who are going without is mostly parents. So both younger and older members, so that would be siblings, but also grandparents are less likely to be deprived compared to adults, adult parents, sorry, in these households with children. It's both parents who experience enhanced risk of deprivation, much higher than anyone else in the household, but it's particularly mothers for the penalty for mothers. Equally, the unemployed and part-time workers are more likely to go without, and this is consistent with other literature that has found that people, when they lose their employment, intend to reduce consumption. So consistent with other literature, but still nice to kind of like find this second part of the story, which titles completes the title to the article. So first the children, then the employed, and then those who are working less or not working. Figure just so you can get a sense of kind of like differences by gender and also by parents and non-parents. And the only point where we see a significant difference between men and women, so mothers and fathers, is or among full-time workers. Mothers are somewhat more likely to be deprived, but the gender differences are relatively small. It tends to be really parents going without as a whole, which is mothers are not in the title. Okay, I've gone, I think, quite fast, but I'm going to summarize. So take-home messages, households prioritize children over adults. This is consistent across countries and also across different elements of the income distribution, who goes without, is it parents, they could be mothers, and the unemployed and part-time workers. And this has implications in terms of social policy, in that the findings really support the idea that if you give money to families, they are going to give it to children. They're going to prioritize those members of the household that really need it. So transfers, great policy to reduce child poverty. Not that I think I need to convince anyone here, but it's still good to have the data behind it. And that's what I got. This is the references, if anyone's keen to check them out. And again, thank you very much for having me.
Thank you very much, Alba. I mean, you kept perfectly to time. That was great. Please, can you post questions in the Q&A box? As I said, it's to the bottom of your screen on the right. We'll let all the speakers speak first, and then we'll have a session of answering questions and a debate about some of the issues that have arisen. So the next speaker I have the privilege to introduce is Eric Marlier, who is undoubtedly one of the world's leading experts on poverty and social policy. He has been the international scientific coordinator of the Luxembourg Institute for Socio-Economic Research for over 20 years, and he has done extensive research on behalf of the European Commission, the United Nations, the OECD, the World Bank, and the Council of Europe, and he has advised many governments on poverty and social policy issues. He has run for many years the European Social Policy Analysis Network, which covers not just the European Union, but 39 European countries. Unfortunately, since Brexit, the UK has no longer a member, which is a huge shame. And hopefully, maybe if we change our government in a few weeks' time, we may be given permission to rejoin. That's one of my personal hopes. Eric is going to talk to you about how to escape from poverty and the extensive research that he has done with his colleague Anne-Catherine Guio and Oliver de Schutter, who is currently the Special Rapporteur on the eradication on extreme poverty and human rights for the United Nations. Over to you, Eric. You have 20 minutes, please.
Yes, there is some echo. Yes, many thanks, Dave, for the kind introduction. Let me try and share the screen. Share. I hope it's working. Can you see it? Yeah. Yes, I have done that. It's fine, but it seems now it's working. Okay. So many thanks again for the kind introduction, Dave, and many thanks for inviting me to contribute to your very nice conference. So my talk is, as you mentioned, primarily based on the book entitled "The Escape from Poverty: Breaking the Vicious Cycles Perpetuating Disadvantage," which is indeed a book published in October last year, very recently, on the International Day for the Eradication of Poverty, and a book that I had the great pleasure of writing together with Anne-Catherine, Olivier, and Hugh. Today, I will focus mainly on three key questions that we tackle in the book. First, what are the main mechanisms that cause the intergenerational poverty, perpetuation of poverty? Second, why is combating poverty and also inequality crucial and urgent, not only to break the intergenerational perpetuation of poverty, but also for the society as a whole? And then my last question would be about the need to fight inequality, and also the fact that it's not enough just to protect people with the basic flow of entitlements. So let me start with the first question. So children who grow up in poverty not only have less chance of reaching their full potential, they also face, obviously, a much higher risk of being poor as adults, and thus of raising their own children in poverty. And a European survey conducted in 2019 compared the at-risk of poverty rate of two groups of adults, aged 25 to 59. A group of adults who, when they were young, when they were in fact teenagers, lived in households with financial difficulties, and a group of adults who, when they were teenagers, lived in households without such difficulties. And as you can see on the slide, at EU level, the at-risk of poverty rate of the first group was 23%, while the AROP of the second group was 13.4%, so a gap of a bit more than 10 percentage points. How can we explain this dynamic, so these vicious cycles? Well, living in poverty means, of course, lacking sufficient income, but not only. It also means having limited access to essential services such as healthcare, education, childcare, housing. It means being more likely to suffer from inadequate nutrition. It means having weaker employment prospects. It also means having few opportunities for saving, acquiring, or inheriting assets, as well as having lower coverage by social protection mechanisms. So poverty-related stress, as well as the erosion of people's aspirations, erosion of self-confidence, and erosion of hope among people experiencing poverty, also play important roles in perpetuating poverty. What is terrible is that all these factors I have just quickly gone through work, in fact, in combination, reinforcing each other and creating, in fact, conditions for systemic forms of exclusion. And let me take just two concrete examples to illustrate this. One is housing and another one is discrimination. So on housing first, low-income households are more likely to live in disadvantaged neighborhoods because housing is unaffordable elsewhere. These areas tend to have fewer green areas where children can play and breathe fresh air, as well as less and/or lower quality public services. As a result, children living in those areas may have more health problems due to bad housing conditions, poor quality housing, overcrowding, etc. This is also due to bad environment, more pollution. So these children also have more risk to be placed in institutions. These children have also, well, a higher chance, a higher risk of being confronted to school segregation and are more likely to attend lower quality schools. They will have a greater risk of school failure or of dropping out of school, which will reduce their employment opportunities later in life when adult and when they will become parents. Another example is discrimination, which also contributes, in fact, to perpetuating poverty across generations. This is in part why poverty is concentrated among certain ethnic groups, why it affects women more than men, or people with disabilities more than people without disabilities. In addition, poverty itself can be a source of discrimination due to negative stereotypes about people in poverty, what some people call povertyism, okay, by analogy with racism. When people in poverty are asked about their experience of poverty, they spontaneously refer to the humiliation and negative stereotyping they face in a number of settings. Just to give a few examples, in their search for a job or for an apartment, in their interactions with school teachers or healthcare providers, also in their encounters with social workers and administrations. So I could give plenty of other examples illustrating that the factors that may cause, accentuate, and also perpetuate poverty are present in many domains of poverty once adult. So it's very difficult to escape poverty, and in fact, many generations sometimes are needed, as I will illustrate very, very shortly in a moment. It is therefore particularly challenging for people experiencing poverty to change, in fact, their trajectories. It is, however, essential to avoid any sense of fate. Poverty is not an unchangeable fate. These impacts of poverty are not inevitable, and they can be reversed. And that's what the title of the book is about. And also that's what we have tried to illustrate with this, with this cover page, highlighting the importance indeed of breaking those vicious cycles. And for this, highlighting the fact that we need to tackle, among others, low education, malnutrition, poor childcare, housing deprivation, and many other issues, many other aspects. But we were limited by the number of words we could include on the cover. Let me now briefly go through some of the main reasons why combating poverty and also inequality more generally is crucial and urgent, not only to break the perpetuation of poverty across generation, but also for the society as a whole. The evidence in our book makes clear that poverty and inequality damage all of us for many different reasons. And here I will mainly focus on two of them. First, why poverty and inequality undermine social cohesion and social solidarity. And second, why poverty and inequality are very costly, in fact, for the society, not only from a social perspective, but also from an economic perspective. So let me start with the first point on this. So the fact that we need to be aware that the persistence of poverty and inequality undermine very seriously social cohesion and social solidarity. It is essential that people experiencing poverty know that they have the opportunity to improve their own situation and the situation of their children. And it is essential that these people are indeed given this opportunity. This will improve their well-being and also strengthen social solidarity. If they lose hope of having the possibility to escape poverty, despair and resentment are likely to set in. And beyond the impact of poverty on despair and resentment, which of course is essential, it is also important to highlight the link that exists between poverty and inequality on the one hand, and civic and political participation on the other hand. Various studies have indeed shown that the higher the level of inequality in a society, the less its members tend to perceive themselves as sharing common goals, which then tends to hinder civic and political participation of citizens, and which can encourage populism or extremist voting. And an analysis of data from 24 European countries has shown that this result holds true for the entire population. I mean by the entire population, from the population across the entire income distribution, but is more pronounced among low-income people. Now, the second reason why it is essential to fight against poverty and social exclusion for the society as a whole, in fact. So poverty and inequalities also generate significant social and economic costs. The benefits for society of fighting poverty and inequality are enormous. As I have already underlined, when a child grows up in poverty, the consequences for them, first as a child and then as an adult, can be numerous and considerable. Health, school success, risk of placement, employment prospects, etc. And this in turn has a huge impact on the society as a whole. It means untapped human potential, wasted talents, in fact, well, loss of productivity. And also it means various social problems associated with poverty that will require significantly heavier investment in terms of public services and social benefits. So the social and economic consequences of poverty and inequalities are considerable, and they are particularly evident as far as children are concerned. And on this, I want to refer to a recent OECD study, a study published in 2022, which tried to assess the economic impact of the long-term consequences of child poverty for 27 European countries. So the 27 EU countries minus Cyprus and Malta, plus Norway and Switzerland. Unfortunately, the UK is not included in the study. Based on various assumptions, the study estimated the total monetary value of the labor market and health penalties associated with socioeconomic disadvantage experienced during childhood, namely the employment and earnings related cost and the health related cost. So by employment and earnings related cost, I mean that once adult, these children are less likely to have a job and more likely to work in lower paid jobs. And by health related cost, I mean that once adult, these children are less likely to live long in good health. So on average, for the 27 European countries covered by the study, historic childhood disadvantage, as they call it, would cost the equivalent of as much as 3.4% of GDP in lost employment, earnings, and health. Well, this is an average which hides major differences across countries, because this percentage goes in fact from 1.4% of GDP in Finland up to 4.3% in Hungary, 4.8% in the Czech Republic, and 6.1% in Lithuania. While these economic costs highlight the importance of tackling childhood socioeconomic disadvantage, in fact, ensuring all children start life on an equal footing with full and equal opportunities is, of course, first and foremost, a matter of equity and fairness. But, as this study shows, there is also an economic case for investing in changing the odds for disadvantaged children. The potential gains from reducing current losses in economic output and welfare are substantial. To finish with, I would like to highlight that it is essential to fight inequality as a whole. That is not enough just to protect people with a basic floor of entitlement, so just to protect them from extreme poverty. And there are at least 4 important reasons for this. The first reason is that there is a link between inequalities and low social mobility. According to a well-known 2018 OECD study, A Broken Social Elevator, How to Promote Social Mobility. So from this study, we know that in low inequality and high mobility countries, such as the Nordic countries, it would take 2 to 3 generations for those born in a low-income household to approach the mean income in their society. By low-income household, they mean households that belong to the first income decile. But in other countries, it is much more. For example, 6 generations are needed in France or Germany, 7 in Hungary, 9 generations in Brazil and South Africa, and even 11 generations in Colombia. Some argue that high levels of inequality are a good thing because it encourages social mobility, because people will be stimulated to climb up the social ladder. But the data show exactly the opposite. The higher the inequalities, the higher the risk of people to be stuck at the bottom of the social ladder when they are raised in low-income households. As quipped by Tony Atkinson, inequality of outcome among today's generation is the source of the unfair advantage received by the next generation. And if we are concerned about equality of opportunity tomorrow, we need to be concerned about inequality of outcome today. So we need to combat inequalities as a way, in fact, to improve social mobility. The second reason why fighting inequality matters is that it is difficult for people in poverty to dream of a different future. This is called by scholars the aspirations gap. And the idea is that when you face high levels of inequality, it is difficult to think about another future for yourself and also for your children than what you have been used to be surrounded with. And indeed, one of the reasons why this aspirations gap can be important is that we depend very much on our ability to flourish on the social networks we can mobilize. And when you are raised in a low-income context, your social networks are more likely to be limited. You will have fewer access to job opportunities because you have fewer connections. You will have fewer role models whom you can seek inspiration from. You will also not have the same opportunities to acquire the social skills that will allow you to succeed in a competitive environment. Thirdly, the more unequal the society, the more investments are likely to go primarily where profits can be made to serve the desires of the rich rather than the needs of people in poverty. And so there will be more pressure to target whatever support there is to the lowest groups of the population, at the risk of creating under-inclusion as a result of these targeting schemes not working pretty well. And there is also a pressure to privatize services that were public, which risks underserving particularly people in poverty. Fourthly, and finally, it is important to know that people in poverty may also face exclusion because they cannot match social expectations. Today, even if your basic needs are satisfied, you may feel excluded just because you can't have a mobile phone, just because you can't send your child to certain post-school activities, because you can't provide your child with the right kind of clothes or equipment for school, etc. And thus high inequalities mean that this kind of social exclusion become worse. So to conclude, the perpetuation of poverty from one generation to the next, poverty and especially child poverty and also inequalities are all very closely interrelated. They are, of course, bad for people concerned, children and adults, but also for the society as a whole. And they need to be fought against very strongly and very urgently. And this fight can be won, as we try to demonstrate very concretely in our book, which is available for free and open access on the internet. And also, as we say, it's also on sale in all good bookstores. Many thanks.
Thank you very much, Eric, for that fantastic presentation. Again, please, if you have questions for Eric on the presentation, please put them in the Q&A box, which should be close to the bottom of your right-hand screen. And thank you again for highlighting the importance that ending child poverty, preventing the perpetuation of poverty, not only has a cost in terms of how much it would cost to help do that, but actually it would be a gain to the economy given the historical costs in terms of impact on GDP. Our next speaker, I'm delighted to introduce, is Dr. Anne-Catherine Guio, who is a senior researcher also at the Luxembourg Institute for Socio-Economic Research. I think very few people would argue with my assessment that she has done more practical work to improve the measurement of poverty in Europe and the understanding of poverty in Europe than anyone who has ever lived. Her PhD thesis was one of the most important ever written on the measurement of poverty and is available for download from the University of Antwerp, and I recommend it to everyone. Her work has been central to both the feasibility and the delivery of the European Child Guarantee. Many speakers yesterday's session on the UK believe that a similar guarantee in the UK would be one of the major ways we could improve the lives of children in the United Kingdom. And it's my personal hope that this important policy initiative may, after 2030, be extended not just to all European children, but governments of the world may adopt it so that there's a universal child guarantee. So I'm looking forward to hearing Anne-Catherine talk about the European Child Guarantee. Over to you, Anne-Catherine. You have 20 minutes.
Many thanks, Dave, for your nice words and also for inviting me. So I will share my screen. Yes. Okay. Okay. So thank you again for the invitation. As we also, it's in time of crisis, the importance of structural policies which can protect and empower people are essential. And we believe that the child guarantee is one of the key policy that can play this role. It's a new initiative adopted at the European level in 2021. The objective of the child guarantee is to guarantee for children in need effective and free access to 4 services, so high quality, early childcare, education and school-based activities, school meals and healthcare, and also to guarantee effective access to healthy nutrition and adequate housing. For this, children in need are defined at the EU level as children suffering from poverty and social exclusion. There's the union of 3 indicators, as you may know: income poverty, which is a relative concept. The threshold is based on the national income, 60% of the national equivalent income. The quasi-jobless household indicator, which measure the percentage of activity at the household level for active age or household member, and also the severe deprivation indicator. So at the EU level, there are around 20 million children suffering from at risk of poverty or social exclusion. The objective of this presentation is to present the synthesis report that we drafted in the context of the European Social Policy Analysis Network. The objective is to provide a first mapping of the situation in the different EU countries. This report is based on 27 country-level analysis by the ESPAN experts based on the available evidence in the country. Before Brexit, for the UK, it was Jonathan Bradshaw and Fran Bennett that who we miss them a lot, who were our experts for the UK. So we made this mapping in the feasibility study before the adoption of the child guarantee, and we renewed it last year at the demand of the European Commission. By effective access, the recommendation means a situation in which services are available, affordable, of good quality, and provided in a timely manner. And by free access, they mean a free of charge provision, either because it's supplied for free or because the states provide adequate benefits to cover the cost of the services. The focus in our report is not on ROP, at risk of poverty or social exclusion children, which is a statistical creature, but on the low-income criteria used in the different policies in the different countries. Of course, it's very different from the focus of the child guarantee, and each time we try to compare the threshold used to the poverty threshold in the different countries. The focus is also on the 6 services that are there in reality, which can be very different of what the constitution or the law foresee. So for each services, the national expert try to identify the financial and non-financial barriers which hinder access in the country. So let's first see the situation for childcare below 3 years. So as you can see on the screen, about half of the member states fail to provide legal entitlement and free access to public funded childcare, even for low-income children. Moreover, low-income children have priority to public funded childcare in only 8 countries. Furthermore, there are a lot of regional and local diversity in provision in many member states. There are also different ages for the entitlement, starting from 0 in Finland and 18 months in Estonia, for example. And compared to the value of the national poverty threshold, as I said, the low-income criterion used to define the low-income children which can have access to free childcare is much lower in different countries. For example, Cyprus, Slovenia, somewhat lower in some countries, and similar in Portugal, much higher in Finland. For preschool, there the situation is a bit better. Almost every member state provides legal entitlement and free access to public funded preschool for all children, but there may be hidden costs. The lack of available places and the relating waiting list throughout the country or in some territories or localities are the main non-financial barriers. The priority that some countries give to working parents or dual earner also tend to discriminate against low-income children, as they are more likely to live in households with less employment. And additional cultural or personal perception as well as attitude may also act as barriers. Regarding education, we covered the cost of different items, so mainly basic school materials, manual, textbook, notebooks, specific compulsory clothing, IT equipment, sorry, sport equipment, some extramural activities which are part of the curriculum, and transport costs. As you can see on the screen, only 6 countries provide for free all or nearly all the items when requested to all or at least low-income primary and secondary pupils. All but 3 countries provide specific cash benefits, one-off support, regular benefit, or both to help meet educational costs. But in most cases, we don't know if these transfers are adequate to cover the costs of education, which are rarely documented in the different countries. Regarding school meals, which we think is very important for poor children, there are broadly 3 main types of provision in the member states. First, the universal free provision in compulsory education in a few member states, or for some age group in additional 4 member states, which is the provision which is the easiest to target low-income children, as we saw in our study. The free provision targeting specifically low children have difficulties in terms of definition of the criteria to target children, but also risk of low take-up or stigmatization. In green, you can see the country in which the poverty threshold is quite close to the threshold used to define the low-income children. But in red, you can see the countries where the targeted children by the school meal provision are much lower than the proportion of people, of children in poverty. There are a third type of provision which focused on targeted schools or areas in Belgium, Greece, Ireland, Netherlands, and Romania. Here the risk is missing all the poor children who are not in the targeted school, or to miss some disadvantaged schools which have not the infrastructure or the possibility to apply to the provision. And there are also 5 member states we have almost no provision of school meals at all. The financial barrier remains a barrier for all the children who don't have access to free provision. And among the non-financial barriers, perhaps the more important, the geographical disparity in many countries, also the lack of infrastructure and the staff, the food suppliers in some countries. But for all the barriers, we could find good examples of policies which work in another country and which show that it's possible to provide free school meals for all children. There are, of course, some barriers which are linked to the type of provision, for example, the administrative burden for schools when it's targeted to schools, the administrative burden for parents when it's targeting to low-income parents, and the risk of stigmatization when children are targeted at the school level. Regarding healthcare, we show that the outpatient care by GP, infant nurses, vaccination are the 3 healthcare services for which more EU countries provide free access for all children, not only for low-income children. Similarly, for specialists, it's also free, regardless of income in 22 member states, and in 2 additional member states, it's free for low-income children. And dental care is free in 21 member states. The most problematic item are the prescribed medicines, which strongly depends on the income situation of the child. It's provided for free to all children in only 8 member states and to low-income children in 11 other member states, with criteria which are usually lower than the at-risk of poverty threshold. So overall, only 10 member states provide free access to low-income children for all 6 health services that we covered in the report. But again, there is a lack of data on healthcare delivery and the cost for low-income children, and including the difficulty to identify the take-up of the benefits and the adequacy for low-income children. The main barriers that we identify is the understaffing in many countries, the long waiting list, the organizational and administrative barriers in some member states, the disparities between regions in many member states, and also the low health literacy identified by a few studies in some member states. The access to nutrition is also covered by our report, even if it's not provided for free, but it should be adequate. So among the non-financial barriers, many member states identify the problems of low education or low literacy in terms of nutrition. Also the difficulty with accessing healthy food or the supply of unhealthy food in the low-income neighborhoods. In some countries, also the identification of food desert and difficulties having healthy food supply, and also the lack of a national framework to encourage nutrition for low-income children. In many countries, in most countries, there are food distribution via food banks, etc. And in some of them, there are cash benefits specifically dedicated to nutrition. Regarding access to housing, the main policies in place are housing allowance, either for low-income renter or for low-income household in general. There is a lot of different definition of the different provision of social housing, and it makes really difficult to compare the different provision between the different member states. But based on available evidence, there are only 3 member states: Austria, Denmark, and the Netherlands, who publicly fund housing to 20% of the total housing stock. The eligibility conditions in general are the same for low-income children, low-income households with children, but often priority access when children are present. So in conclusion, there are still many gaps in provision and barriers to access. In the National Action Plan that countries has to provide to the European Commission, there are many plans where there is a lack of holistic and coordinated approach and a strong political determination backed by clear financial commitments. There is also a problem of monitoring framework, a lack of targets in many member states, and a lack in general of data in the different member states on the service delivery and the cost for low-income children, including the adequacy of the benefits and the take-up. But to end on a positive tone, we strongly believe that there is a powerful role for the EU in reinforcing the investment in children and in poor children via the child guarantee. And compared to our first mapping during the feasibility study, the situation has improved in some member states. Some member states really took it seriously and launched big reform to improve the provision for low-income children. And we also saw some member states developing really important tools to assess the impact of the policies on specific groups of children, making them more efficient and effective. For example, in Lithuania, the progress has been amazing. So many thanks.
Thank you very much, Anne-Catherine, for that fascinating and informative talk. Again, if you want to ask questions to Anne-Catherine about the huge amount of content in that talk, please use the Q&A button at the bottom of your screens. Okay, we now move on to our final speaker, who's last but not least, Amy Raub. Amy is joining us from Melbourne in Australia, where she lives, but she is the Director of Research at the World Policy Analysis Center in Los Angeles, and therefore undoubtedly has one of the longest commutes to work of anyone I've ever met, a distance of 13,000 kilometers or so. A single flight. Amy has done seminal research on the quantitative analyses of comparative policy measures. Her scope of her research is truly global and includes all 193 UN member states, not just Europe, but every UN country in the world, and it covers a whole range of topics, not just poverty, but aging, early childhood, gender, education, etc., in an attempt to see what policies or combinations of policies and laws lead to positive outcomes. So she tries to disentangle the very complex relationship between policies and laws and positive and negative outcomes for the population, in order to give practical advice on what are the best policies for countries to adopt, or combinations of policies for countries to adopt, to try and achieve the aims that policymakers and the public desire. She has presented her work and the work of her colleagues to many international organizations, many civil society organizations, many academic researchers and governments across all 5 continents of the planet. She has authored extensively with many important books and peer-refereed journal articles, and I recommend them to you. They're all excellent. Amy is going to talk about COVID-19, gender, and caregiving. You've got 20 minutes, Amy. Thanks.
Thanks so much, Dave, and thank you, BPI, for having me amongst this really fantastic panel. And I'd also like to pay my respects to the Wurundjeri people of the Kulin Nation on whose land I'm speaking today. So we all know the absolutely devastating consequences that the pandemic had on education, on school closures, really increasing markedly childcare needs during the pandemic. And in many countries, this triggered what was called a she-cession, impacting women's economic opportunities much more than men's, and in particular, mothers. But these gender and care gaps are, of course, something that was very much in place prior to the pandemic. In 2019, the ILO estimated that there were 606 million women out of the labor force due to care needs, compared to just 41 million men. And many different international agencies have tried to estimate the cost of this and how long it's going to take to close this. The World Economic Forum, prior to COVID, was estimating that it was going to take 257 years if we continue on this path to close the gender pay gap. They release new estimates all the time. They jump around, but generally it's 100 to 200 years to achieve gender equality. So that was the impetus for our book, Equality Within Our Lifetimes. Really, what are the laws and policies that can close these gaps? Because so often, the laws and policies that countries have in place, they have gaps that perpetuate and exacerbate gender inequalities. So this is a freely downloadable open access ebook, or you can also, of course, buy it in many fine bookstores as well, I hope. So as part of this, we're sharing globally comparative quantitative data on laws and policies around the world. And I think Anne-Catherine's presentation gave a really powerful demonstration of why you need data on policies. Because when you have what governments are doing, data on implementation, and outcomes data, you can start to really advance evidence-based decision-making. You can also have that monitoring and accountability of where are governments failing to take even that first step to reducing poverty, to reducing inequalities. And you can also learn from the experiences across nations of what's working as a policy approach and what's not by rigorously analyzing this data. I'm going to focus today on gender and caregiving, but this is just a really small slice of all of the data that the world has on laws and policies in all 193 countries. We have a deep emphasis on poverty, on equal opportunities at work, on education, on child marriage. And all of this data is freely downloadable on our website. It's worldpolicyscenter.org. All of the data that you'll see mapped today is constructed from original source legislation. This is a really massive undertaking. We have a multilingual, multidisciplinary team for each country, for each data point that you see mapped. 2 researchers are independently reading legislation in full to answer questions from a coding framework about that legislation. They're then reconciling their answers, and we go through a long process of data cleaning and verification of outliers. So what does mapping laws and policies really look like? One of the advantages of mapping is you can see really quickly where the world is making progress in an area and where there are legal gaps. So this was a piece not in the book, but I thought relevant for this talk on paid leave policies that were introduced or expanded during the pandemic to help parents whose children were out of school or were out of childcare balance those work and caregiving needs. And despite the global impact of all of these school and childcare center closures, it was only a minority of countries that introduced or expanded policies to help working parents hold on to their jobs through paid leave to meet these care needs. And of course, this is only one small detail. It's not enough that these laws are in place, but it also matters about how much wage replacement there is to keep people out of poverty, whether it's sufficient for the duration, who's eligible. Those are all of the types of detail that we also capture with our data. Coming out of the pandemic and thinking post-COVID, have our policies really learned from the pandemic? So this is data from 2022, looking at whether working parents are guaranteed any leave for children's everyday health needs. And of course, this matters particularly to workers in more precarious employment, whether they can take leave from work if their child is sick. It matters to public health, whether parents are keeping their kids home when they have flu, when they have gastro, stopping disease spread. And as you can see here, less than half of the world has policies in place guaranteeing paid leave to working parents. And there are even a couple that embed gender inequality in care in their laws by making this leave only available to mothers and not fathers. If we think about children's serious illness, you can see here that much more of the world guarantees paid leave for children's serious illness. Children with serious illness have tremendous consequences for parental employment, just due to the scale of health needs, the scale of the need to take time away from work. The concerning thing is too often this leave really isn't long enough to meet the duration of the health need. So for a child recently diagnosed with cancer, for certain cancers, the parents will need as much as a year off from work. Here, this graph is looking at whether countries have a much more modest amount, at least 6 weeks of paid leave for parents to take time off of work to meet their serious health needs. And you can see in low and middle income countries, it's less than a quarter of countries, very small percentages having paid leave for lengthier paid leave for children. But this is also a very large gap in high income countries. Less than half of these countries have even 6 weeks, which is a very modest amount for some more serious health needs. And these gaps are even greater when we look at things like aging and elder care. This is, of course, an increasing concern for everyone globally as populations are aging, as people are living longer. There is an increased need for elder care, and policies have given more coverage for children than for elder care. But this is also quite an important aspect. Turning beyond beyond later childhood, you can see here that lengthier paid leave for caregiving is feasible. So nearly every country in the world, with the exception of the United States, Papua New Guinea, and a few small Pacific Island states, guarantees paid leave for infant caregiving. This enables parents to bond with their child after the birth of an infant. It supports exclusive breastfeeding, which matters to infant health, that supports recovery from birth, which matters to maternal health. And it just supports that round-the-clock care during infancy. Also encouraging, all of the countries in green, light green and dark green, meet the minimum recommendations by the International Labor Organization for paid leave. So countries have been able to afford lengthier leaves. At the same time, countries have a lot farther to go on supporting gender equality in care. We're not going to achieve gender equality at work without addressing gender equality in care, and we can't fix gender equality in care only through policies addressing mothers. We have to think about fathers too. Here you can see all of the countries in red don't have any paid leave at all for fathers. That's about 40% of the world. This is 2022 data, so some countries have moved forward since then. Those in orange don't have any paid leave reserved for fathers, and we know when paid leave is shared, when it's not specifically for fathers, they're less likely to take it. And those in yellow have more limited leave reserved for dads. So usually this is less than 2 weeks. The good news is by looking at this data longitudinally, we can see progress over time. We can see that paid leave for fathers has really expanded markedly since 1995. This isn't just in high-income countries. We're seeing tripling, quadrupling of paid parental leave in Africa and Latin America and the Caribbean. And of course, the EU Work Family Directive has also helped support increasing leave over the past few years. So how can we use this data not only to highlight the gaps, but to really learn more about what's working in policies and what's not? One way is by merging the data with household survey data, we can start to quantify structural inequalities embedded in the laws themselves. We've done this for OECD countries, looking at structural inequalities related to tenure requirements to access paid leave and benefit levels for whether paid leave is affordable for minimum wage and average wage earners. This is an example of a recent project we've done in the US related to some of the state level paid leave provisions. So this is looking at Washington State, which has improved upon the federal standard of no paid leave for parents or for serious illness as well, by passing their own state paid leave policy. But what we can see here is when we start to look at the policy details, these policies are still reinforcing structural inequalities. The gray are the percentage of people who are ineligible to take paid leave because they don't meet the minimum earnings requirements or the employer size requirements. And you can see that lower education levels are twice as likely to be ineligible as people with a college or higher degree. Then when we stack on top of that, people who are eligible, but leave might not be affordable to them because the wage replacement is too low or the cap on that is too low. Again, we can see that this is disproportionately impacting people with less education, particularly less than high school, where more than a third are excluded compared to 10% with a college degree. And then finally, a relatively unique feature of many of the state level paid leave policies in the US is a lack of the same requirements to receive job protection as benefits. So many rely on the federal guarantee of unpaid leave to govern job protection. So that means you're only eligible for job protection if you've been with your employer for at least a year, excluding anyone who's recently changed their job. If you work 1,250 hours a year, excluding many women who work part-time, or if you work for an employer with less than 50 people, which disproportionately excludes Latinx workers. And you can see across the board, these job protection eligibility criteria exclude about 30% of workers, regardless of their education level. But when you add up all of these disadvantages, workers with less than a high school education in Washington State are more than 80% are ineligible, compared to less than half of those with a college or higher degree. Another way we can use this data is to answer questions about what actually works. Do these policies improve outcomes? And to do this, it's not feasible, it's not ethical to randomize a policy experiment. So we can't conduct a randomized control trial on policies. But what we can do is leverage natural experiments and policies that happen between countries. So by merging longitudinal policy data onto repeated cross-sectional household surveys, and using quasi-experimental difference in difference methods, we can look at changes in outcomes in countries that passed new laws and policies compared to changes in outcomes in countries that didn't, and control for all of these other confounding factors, GDP, what they're spending on health and education, as well as household level factors, to try and get at the best possible evidence there is for the impact that these policies have on outcomes. So as an example, this is a study we did with partners around paid maternity leave and infant mortality. Prior to this study, there was really good evidence that in high-income countries, paid maternity leave reduced infant mortality. But there were a lot of questions about whether these same policies actually mattered in lower income settings. Do people actually get the benefits? For workers in the informal economy, there, in many cases, policies don't reach. Does this still benefit people, or do mechanisms to cover the self-employed actually reach them? So using data on more than 280,000 births across 20 low and middle income countries from the DHS surveys, we looked at whether extending the duration of paid maternity leave decreased the probability of infant death, and found that for each additional month of paid leave, there were fewer infant deaths, a 14% relative reduction from the mean. And subsequent studies on this have also shown plausible mechanisms through exclusive breastfeeding, through increased vaccination rates, through reduced bloody diarrhea. We've also been doing these studies in other areas, looking at educational outcomes. Do education policies actually work to improve educational attainment, domestic violence laws, do domestic violence laws work to improve child nutrition, gender norms as well. There's just a tremendous wealth of opportunities for how the data can be used to kind of answer these questions about what's working, where, and under what conditions. So all of the data that I've shared with you today is available, freely available for download. This is just a screenshot of our website. You can go to the corner button and there's the data download. We also have interactive maps and other things. And we very much welcome partnerships and exploring ways that we can work together on poverty and inequality and other issues. So thank you.
Thank you very much, Amy, for that really interesting and important talk. Okay, you've all, the four speakers have kept brilliantly to time. I didn't have to intervene at all, to which I thank you. And so we now have a half an hour or so, 30 minutes or so for questions. And there are already some posted in the Q&A box. And if you have more, please post them. So the first question that's live at the moment is from Shoylin Nandi at the University of Cardiff, and he has a question for Amy, which says, given the US appears in red for several of the indicators, no provision, how do policymakers in the states just react to justify such a situation, given that such policies are clearly helpful for families?
And I think that's the power of the global data. They are moved by it, is my experience. So the value of mapping globally versus just mapping certain countries is different policymakers respond differently to comparisons. So some US policymakers may not care that Europe has paid leave. That's just what Europe does, but they are moved when they see that Guatemala has paid leave, and countries that they might perceive as maybe not on equal footing, doing better on this has been a powerful motivator across the political aisle. And overwhelmingly now, the US public is in support of paid leave, and that spans the political divide. Republicans, Democrats, and independents are all polling very high on support for paid leave policies. What we've seen is it's not moving at the federal level, for a variety of reasons that we won't go into here, but there has been real movement at the state level. There are now 13 states, plus the District of Columbia and Puerto Rico, with paid leave policies in place. And this is an active area with even more conservative leaning states also beginning to consider how they can make paid leave work in their setting as well.
Thanks very much, Amy. The US, of course, has a federal system, as does a number of other countries. India, Mexico, China has provinces. Is there much, do you have much data? Is there much differentiation by these kind of regional and federal organizations that are policy making?
So it really varies the extent to which which legal areas federal law covers versus state law. China, for example, on paid parental leave, a lot of their subnational units are leading. Paid paternity leave in China is entirely through subnational regions, or at least it was the last time we updated the data. And many of the subnational regions have lengthier leave than national. In many countries, federal countries, you'll see differences in child marriage laws. We do code for the least protective when we're doing our national data. So that impacts China, that impacts Canada and some maps, that impacts the UK and some maps as well. And we have done projects focused on within country variation as well, because it is important.
Okay, Thanks very much. I'm just going to go through the answered questions just to for people who haven't seen them. So Bungay Maguni has asked, will the slides be available? We intend to put the recordings up on the website of these sessions, and also to make the slides available from today and from yesterday, where we have permission from the speakers to make them available. Ioabi from Japan, Tokyo, has asked Alba about her presentation. She's read all of her work and said she's trying to repeat the work with Japanese data, and she asks, how can we make sure that children are prioritized over adults when the deprivation items and numbers of items are different between children and adults, and the overall rate of adult deprivation is child deprivation different? I try to standardize the child and adult deprivation indexes to make them comparable, but do you think this is a good strategy or unnecessary? Alba, do you want to repeat your answer?
Sure. Thank you very much. I'm an avid reader of Dr. Alba's work, so this is a nice coincidence. So for me, there's two ways to look at this, right? Like there is the element of direct comparability between two indexes, and then there's the issue of like to what extent children and adults' needs are the same, right? So are we interested in our needs being met, or are we interested in like indices that are exactly the same? So what I've done is I've done both. I ran the analysis with the full index, assuming, okay, well, children have needs, for example, in nutrition, but also education, etc., that are different. And that's the one I presented. But I also rerun the analysis with a reduced index. I have just 4 items that are the same. And if I recall correctly, those are clothes, so some new clothes, food, friends over, and there was one more. There's a 4th item that was the same, and the results don't change. Additionally, the paper I cited by Andrea Gavos and colleagues, what they do is they look at item by item. So food in the same household, adult and children have, and they find the same thing. So still, it doesn't matter how you cut the cake, really. Of course, it will vary. Some households will like fall in one way or another, but the story remains the same. So what I did in my papers, because the reviewers asked, is I provided the robustness check of like, okay, with the 4 index item that's more directly comparable, this is what we get. And I would love to see the results for Japan, and if there's anything that looks different, that would be fascinating. Can I also ask Anne-Catherine a question, since I am already talking?
Please go ahead, yeah.
I was very hopeful but with the end of your presentation when you mentioned that already in this brief period, some countries and some policy areas have improved thanks to the child guarantee. I was in the child guarantee group in Spain, and we were not very positive. So I would love to hear a bit more whether certain countries or certain policy areas where you have seen particular progress. And yeah. Thank you very much.
May I reply now? Yeah. 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 In school meals provision, which is easy to map, and there has been an evolution. There are more and more countries providing universal schemes for broader age group. I have a few examples in mind. The Netherlands, for example, didn't provide anything, and now they have started the provision. In Belgium, there are a lot of pilot schemes. It's in the air. Next week or the week just after, there is a workshop, I think organized by Denmark on school meals, and during the Spanish presidency, there has been a workshop as well on school meals, which are many dynamic researchers showing all the value added of school meal for provision. That's for school meal. For childcare as well, I saw an evolution. I don't have all the countries in mind, but I saw an evolution in the provision, but still there are many gaps. And there are, when you look at the EU data, you still see a gap between low-income children and the others in attendance to childcare. That's the two examples that I have in mind. School cost is more difficult to measure. It's almost impossible to measure, so it's difficult to see any improvements. The key issue is really that we lack data on the implementation of the child guarantee, and I think many member states try to improve the monitoring framework and to set targets and so on. But still, my own worry is that some countries don't have such a strategy and just provide a national action plan with a few measures which are already in place without any target, without any vision and strategy, mid-term or long-term strategy to improve the access. And I hope that the peer pressure and the Commission will work to encourage more member states to take it seriously.
Thanks for the answer and for your work.
We have another question for Amy from Patricio Oliveira, who's joining us from Chile, where it must be quite early in the morning. So good morning to you, Patricio. He said, in Chile recently, we've been discussing about the fertility rate, which is too low. Regarding maternity and paternity leave, these policies could also have some influence on the fertility rate. And this is the belief that fertility rates are too low is spreading to many countries in the world. So, Amy, what do you think about that?
I think it's important to keep in mind that parental leave is only a piece of the equation. So while parental leave addresses the most intensive caregiving time period for most parents, unless you also address affordable childcare at the same time, as well as caregiving beyond infancy, where you can see from the maps, a lot of support for care needs just drops off as soon as you leave infancy. It's hard for me to imagine that most people would make decisions based solely on that policy, but it is a testable question. So it is something that you could use policy data and outcome measurements to test.
So there you go, Patricia. There's an offer. The data are available to download, and the World Policy Analysis Centre welcomes collaboration. So the data are there for you to test that. And apart from a few countries in sub-Saharan Africa and some in Asia, most of the countries of the world have now seen fertility fall below replacement ratio levels, including most European countries. I think Sweden may be one of the exceptions in Europe, but by and large, it's a concern in many countries in the world. I have a question. I'm going to abuse my position as the chair for Eric. The idea that poverty can be perpetuated across generations dates right back, that concern, to the revolutionary thought around the French Republic, the formation of the French Republic. The Marquis de Condorcet argued that poverty could be eradicated. It wasn't divine right or bad luck or natural laws, and that it could be eradicated through the provision of welfare state mechanisms, but particularly by instituting rational government, through having rational laws and improving the population through free education. He, of course, also believed in the abolition of slavery and clericalism, and equal political rights for women, and therefore died in prison for his beliefs, as you would in those days. But do you think that these original ideas on how to eradicate the poverty across generations, that education was the answer, is still the answer today, or do we know more than we did 250 years ago?
Well, that's can you switch off your Yeah, okay, thank you. Otherwise, there was an echo in the room. Yes, many thanks. And it's quite nice that you refer to Condorcet, because he is very, very close to my heart since I was a student, also for all the work he did on electoral studies, etc. He was amazing. Well, I agree. Education is certainly a key element. But also, and I think that the European childcare goes in this direction. It's not enough. Education is clearly important. Also, well, in the context of education, making sure that people receive the support they need, because it can't always be provided by the parents. It's not probably the role of parents, in fact, to provide this educational support. But there are also other elements in the European Child Guarantee. I think that, well, the people have highlighted key elements beyond education, which indeed includes access to healthcare is a key element, and also, well, decent nutrition, adequate nutrition. I think that also the school meals, which is also close to our hearts, Anne-Catherine's and mine's, is also a key element, making sure that indeed also children don't go to school while being hungry. That's also part of a good education, even though it's not education itself. So I think that, yes, education is certainly a major lever, but there are others. But I don't know, maybe Anne-Catherine wants to complete this, because we have worked so much together on the book, and also on the European Child Guarantee, which is a bit of our baby. So I don't know, Anne-Catherine, whether you would like to add a few things also.
Nothing new. We know from the PISA data that there is such a gap between by socio-economic status of the students, and the analysis, especially in the countries that we know very well, show that it's not only a question of cost and support, but also segregation of schools and the size and the provision of different support, or the size of the classes, and the provision of support within the school to children from foreign-born children, and especially in Luxembourg, for example, you can see really a segregation based on the language spoken at home. And so there are Portuguese school, so school mainly attending by Portuguese, and there is such a replication of the inequality by school. So it's really key, and I'm afraid that you don't learn anything new. We all know that the problem is more complex than just free education and question of cost.
I completely agree with that. If there are any more questions from the audience, please post them in the Q&A box at the bottom of the screen. I was struck by a number of the slides Amy had showing that what we might think of as good supportive welfare policies were far from confined to the high-income countries or even to European countries. And I just wondered what you thought the feasibility of rolling out the European Child Guarantee areas and policies were to other parts of the world, if policymakers there wanted to follow the example. That's a question to all of you.
I can start on that and say that there's been some really great policy developments coming out of what many call the Global South. If you look at equality legislation, often it's newer legislation there. Some of it's incredibly strong. And these policies are very comprehensive on things like education for children with disabilities, as well as other pieces. So I do think this should be a goal. I mean, you look at Africa and the Maputo Protocol, which is it 20 years old or 25 years old now? Yeah, 20, thank you. The guarantees are on that, they're stronger than the global guarantees of CEDAW. They're really a revolution for strongly providing for women and girls' rights across a wide range of areas. So I think the idea of rolling out a framework like this globally makes sense.
Eric?
Yes, no, I fully agree with Amy, and I think that indeed, as you refer to, Amy, you should see it as a framework, okay, and indeed, and as that was highlighted very clearly in Anne-Catherine's presentation, the framework is key, but within the framework, you also need to have objectives. You need to have ideally also targeted. You need to have indicators for monitoring policies. And I think that if this is taken seriously, this will then, well, put in motion a whole process, which is key. A process which can be also associated with it, and which we have in the EU, is the fact that the European Child Guarantee was not adopted at the same time, just a few months difference, goes in fact hands in hands with a children poverty target. So the child poverty target consists of, in fact, trying to decrease the number of children at risk of poverty or social exclusion between 2020 and 2030 by 5 million. So in fact, it's a whole poverty target, 15 million within 10 years. And within these 15 millions, at least 5 million should be children below 18. And also this, well, of course, reaching the target is important. But as important as reaching it, the whole dynamic that goes with it, okay, is the country making progress? If yes, can we understand thanks to which policy or policies, the mix of policies that have been successful? Is the country not making progress despite the policies? So understanding all these well, successful and failure so policies is really key. But the whole dynamic and having a framework with specific targets, I think indeed makes sense. And then this framework can be adapted, of course, to the country's reality. But I agree with Amy. It does make sense in all countries, according to me.
If I may add something, yeah, there is a particularity at the EU level, that's the EU funding, and that's something important for many countries. And with the child guarantee, there has been some conditionality of having some funds. So some countries with a high poverty rate for children have to spend proportion, I don't remember which proportion of the funds they receive to fight child poverty, which is something important. And the other point I wanted to make is perhaps to give courage to everybody. When we start working on this topic, the first meeting we had, we were told that we shouldn't be too committed because we have a reputation to be committed, and we should be really aware that there will not be any child guarantee at the European level. So it was just to have a study on the possibility to have something, but the political willingness was not there at the beginning of the contract. And then there are a few miracles. And at the European Parliament, there have been a meeting with Ursula von der Leyen. And at the end of this meeting, they decided to have a child guarantee, and then it happens. So it could be really important to have some courage and fight to have such a framework. And I think it's possible till the end, because sometimes it's just a question of political willingness, and there can be some positive things which happened.
That's a really good message. Never give up hope. So yesterday there was a long debate about the importance of free school meals in the UK and how some regional governments, Scotland, Wales, London, have implemented it, even though the national one hasn't. But the UK government, instead of adopting a child guarantee, has adopted a child poverty guarantee for families which have 3 or more children, in that after 2 children, all benefits are cut off and the safety net has been removed. And this is based upon the idea that it will discourage poor parents from having more children, a kind of eugenics approach by our government's policymakers. Of course, if you lose your job or become sick and you have 3 or more children and you have to get welfare benefits, then you are guaranteed that your children will be in poverty, more or less. So I just wondered, asking from Alba's very clear results, why policymakers still persist in believing that parents are feckless, and if you gave them more money, that they wouldn't spend it on their children, but would spend it on wine, women, and song, or rock and roll, or whatever. Why this seems to be this seems to be a persistent rhetoric, not just in the UK, but in many countries, and yet it seems unsupported by the evidence. Why do you think it exists?
Oh God, that's a good question. It's one of those zombie ideas, I think, right? Like narratives of deservingness have extended everywhere, and I don't think they're particularly grounded in evidence. Like Spain has recently introduced a minimum income scheme 2-3 years ago, but before we didn't have it. What we did have was the narrative that families want to live on benefits, even though those benefits didn't exist, right? So I think it's just something that that's like a pervasive policy thing. I honestly don't have an answer. I have more anecdotes, right? Like I was flown to Germany last year to present this work because they were considering extending child benefits, and I presented the work, and everyone was like telling me, yeah, this is clear message. But are you really sure some families, like, have you looked at this 1 or 2% who are not making the right decisions? Who are they? How can we know more about them? And I feel like there's a concern sometimes more about people who may abuse the system than about what happens to children of the ones who don't abuse the system, right? Like there's more discomfort seems to be with teaching than with people being not covered by, because if you're with the 3 children example, where, like with it in the UK, what you're saying is, okay, some families have 3 children and they're very responsible, but we're going to sacrifice them because there's some families who have 3 children in this imagination to live off the state. So for me, it's about changing the narrative of like what's worse, that some people cheat the system or that lots of people go without. I think Eric was keen to maybe add something better to my answer.
Eric? Did you want to add something? You're on mute.
No, I don't have anything to add. Thank you, Alba.
I just saw the mic going on, and I thought maybe.
So if you want to ask more questions, please use the Q&A at the bottom. Otherwise, I will just keep chatting away for a bit. Again, on that kind of ideology, the UK government was very worried a few years ago that there were multi-generation workless families, that their families where the children hadn't worked, the parents hadn't worked, and the grandchildren hadn't worked, and there was this transmission of poverty down the generations through a culture of worklessness. And the Research Council funded Tracy Sheldrick and her colleagues in Newcastle to go and study this really prevalent and dangerous problem for society. And they went to the areas of the UK which had a long history of unemployment, but they were unable to find a single example of a family with 3 generations where no one had worked. even though it was in the press and in the political discourse, in terms of evidence and social scientists, we could not find a single anecdote, let alone any population to study. I just wonder why that idea of a transmission of poverty through culture is still again prevalent. Yeah. It occur, is it just a UK phenomenon, or do you find it in other parts of the world?
It's definitely not just UK. I wish I had an answer. I really don't. I'm very curious about Amy's point of view as a US rep today, because I do feel the UK and the US do lead that narrative in some ways, right? I don't know if that's.
I mean, in the US, there's the whole welfare moms issue, Reagan. But I think we see this in a lot of if you look at the benefits on, say, paid parental leave, they're generally much lower in Anglophone countries, in the UK, Ireland, Australia, New Zealand, Canada. They're all very low, close to minimum wage, statutory pay levels, and this just decreases the affordability for parents. It decreases the ability for main breadwinners to really take leave when so much of the household income will be lost. So it's more of a loss than anything else that we just keep perpetuating this story.
Yes, no, I agree. But I would say that there is something quite encouraging, which is that now, since almost 10 years, probably around 10 years, the OECD has been extremely active in indeed contributing to highlighting, well, I refer to a study of 2018 concerning the social elevator. I think it was really a very, very good study. And at that time, very few people were expecting that the OECD at some point would issue such important publications. And of course, well, Canada and the US, for example, are part of it. So hopefully, indeed, well, slowly but surely, this will make a difference. But I think that concerning the culture that you refer to, well, I assume that it's because it's easy and because you always need to have a black sheep. I think it's also part of the game. And that very simplistic arguments tend to be very well received by many people. Yes, but hopefully you refer to the study by Tracy, the UCD studies, the book we have just published, and hopefully that in the end, also with all the work by NGOs, ATD, EAPN, etc., hopefully that in the end, well, it would trickle to the right people. Yes, so that's at least my hope.
Have a question from Henry Jang, who says, do you find there's any relevance or comparability between the 1918 flu and the recent COVID pandemic? Will that be helpful to compare these two worldwide pandemics? And do you think the pandemic is a side effect of globalization or a cause of a global economic crisis? So did globalization contribute to it? Does someone want to try and answer that? You've stunned the panel into silence, Henry. The trouble is that it's quite hard to compare the 1918 pandemic with the current one 100 years later, particularly because of the much greater medical knowledge now. There was plenty of globalization in 1918, particularly with the end of the First World War and troops returning from all over the world, which contributed to the spread then. There's obviously more now, but they both were major crises and both surprisingly understudied at the moment in terms of their impact. Countries seem to want to move on after pandemics. Does anyone want to add to that?
Yes, just to break the ice. Well, it's a complicated question.
It is.
Well, I think that of course a big issue, if you want to do that, would be related to data. So COVID fell at the right moment in terms of data collection. But another aspect which I think might be possible to study, and this is related to in fact the work by Amy, is to look at whether or not some important social policy, well, were put in place in terms of social protection, etc. So have some countries put in place specific policies, and was it just on the spot and that was it, or has it then implied a longer term change? Because that's also what we studied when we analyzed COVID-19, is whether indeed both countries had adopted just policies for addressing the COVID-19 consequences, and at the end of COVID that was it, or whether some countries did change in fact some important elements of their social protection system. This, I assume, would be possible because we would have this kind of data. We're trying to see whether indeed there has been a pre and post social protection dynamic. So a pre and post flu, I mean, but I don't know, Amy.
Yeah, I mean, we have looked at that some. So paid sick leave was was a very important policy intervention during the pandemic. Many countries had waiting periods on their paid sick leave policies because of this idea that workers pretend they're sick and they stay home. So if we don't pay them from the first day of illness, they won't have this absenteeism. Of course, for preventing disease spread, whether it's COVID, the flu, gastro, you want people to stay home as soon as they're sick and not have to worry about choosing between income and spreading disease in the workforce. And during the pandemic, we saw quite a few countries waive these waiting periods to make sure people stayed home. We haven't seen as big of a change in making those policies permanent. And you see countries like the US introduced paid leave during the pandemic that they didn't have before, was not permanent. Other countries expanded eligibility, they expanded benefits, recognizing that these policies weren't adequately reaching the poor, but then they didn't continue that after the pandemic. And of course, that continues to undermine health. It also means we're not as prepared. COVID was a global pandemic, but we've certainly had other epidemics before, H1N1, that have had enormous economic costs. And we know these social protections help for disease outbreaks. They also help for climate change, for natural disasters. So I think it's really important that we think about social protection, not just for every day, but also for these disasters that we will continue to have to face in the face of climate change.
Yeah.
Thank you. I just want to, sorry, Gary, we're coming to the end, yes.
Yeah, so very briefly, I think that an area where the pandemic has allowed for some progress to be made is the access to social protection for the self-employed and the non-standard workers. So I think that the dynamic at EU level, which is quite strong now, to improve this social protection throughout all 27 EU countries, has been largely facilitated by the fact that countries had to find solutions for protecting these people during the pandemic. And so I do think that the pandemic has helped, in fact, sort of to feed into this this dynamic. But otherwise, all the leaves, etc. Well, in 1918 they were virtually absent. Certainly the paternity leave, but yes, I agree with Amy that otherwise most countries have mainly adopted measures strictly limited to the pandemic period, but not all of them. At least a few progress has been made.
Okay, thanks very much. I need to wrap up now, but just to add to that, those important comments, arguably one effect of the First World War and the flu pandemic around the globe was the adoption of beginning to be the adoption of global policies, social policies and economic policies. Before the First World War, they really had just been regional agreements rather than global agreements. And so you saw in 1924, 100 years ago, this November, the adoption of by the League of Nations of the Declaration of the Rights of the Child, which was the first ever human rights international agreement. And hopefully one of the positive effects of the COVID pandemic will be a strengthening of global social and economic policy and environment policy over the coming years, because everyone in the world realizes we're all in it together, really, in terms of the outcomes for the planet. Okay, so we've had an excellent session, which I now need to bring to a close. At 1:30 UK time, there will be another session on poverty and COVID in Africa, where we have some excellent speakers from Ghana, South Africa, and Cameroon. And there will be a short break of half an hour, and then at 4 o'clock UK time, we'll move over to poverty and COVID in the Americas with speakers from both North America and South America. So thank you very much for joining us, and I look forward to seeing you after lunch my time, and whatever time it is where you are. Thank you very much, and thank you to all the excellent speakers and to also the BPI staff who have made this possible.